Hey, what is happening in Alameda, Contra Costa, and Solano counties? Welcome to today's episode of the Capstone Conversation. I am your host, Jared Asch. Today, I am joined by Jason Parks of Las Trampas here in Lafayette, a nonprofit that serves our community. Welcome, Jason. Tell us what Las Trampas does and how you serve everybody.
Well, thank you for having me today, Jared. Las Trampas was founded back in the early 30s as a school for children with disabilities and became a living situation for kids with disabilities in 1958 when Las Trampas was built more as a school setting that the kids lived here, stayed here the whole time. That's how the system worked way back in the day. Those kids eventually grew up. We changed as an organization to more of an adult day program with people who could live on the premises. But in 1990, 91, we had our last participant actually move out of our location here in Las Trampas, and we just became a solid straight day program. During that time, we developed other programs, supported living or independent living, where we actually have staff that go out into the community to support people in their homes, either part-time, which is basic, life skills, shopping, budgeting, house cleaning, etc., or actually living with them 24/7 if they need that much care and support. We have two residential homes right now, one senior women's home, which has four women in it right now, that's in Pleasant Hill. And we also have a men's home that's also in Pleasant Hill. That's also another 4-bedroom house. They're the people who live there. I have 24-hour care and total support for all their needs. But back to Las Trampas, the adult day program itself, we have about 70 adults at the moment who come here from basically Monday through Friday to 9 to 3. And they get to experience just basic, art programs, health and wellness, life skills, social skills, etc., community activities. It's for those who choose to want to be active throughout the day. And that's kind of like where we're at Las Trampas right now.
And where do those people come from that you serve?
Oh, they come from Contra Costa County. Now our funding is from state and federal government grants through the regional center in the East Bay. A person who wants to come to Las Trampas through their case manager at the regional center sends over a referral packet. We see if we can meet their care and support needs. They come from Lafayette, Walnut Creek, Concord. Usually it's within a 20-mile radius that they come from to Lafayette, where we're located.
How many other of these centers are there between like Alameda, Contra Costa, and Solano?
Oh, that's a good question. I mean, I would say there's probably a couple thousand easily. I mean,
Facilities or service people?
service providers, easily forget the exact number. I believe there's over 40,000 service providers in the state of California, but I mean, a service provider can just be, just a few people or, rather large companies like us.
Wow, what a big network. I didn't realize how big of a service operation it is. All of the funding comes from state, county tax dollars, right? Federal tax dollar, right?
State government funds basically a little over half. The federal government funds the other part. So right now, well, I'm kind of jumping ahead, but right now we're asking for we're budgeted for $600 million coming from the state, with federal matching funds of another $400 million. So that'll be almost $1 billion that we'll get in this next fiscal year for the whole system, not just Las Trampas.
And we're going to come back to that $1 billion that Jason's getting for his facility in a minute. Jason, before we go into budget, let's talk about who is Jason and what is your role at the organization?
Well, I'm the director of day services here at Las Trampas. I never thought of this as a career until about 10 years ago. My wife and I lived in Martinez. I was a stay-at-home parent for 14 years, finished school, and I was looking for a job. And I started with another provider supporting people with disabilities getting jobs. I was doing supportive employment. They would get their own jobs, support them from anywhere from, you see a person working in a grocery store as a bagger, retail, or even I was very fortunate to support somebody who got their degree from Cal State East Bay and supported them in getting a job at a microbiology lab. So, I mean, it's the full spectrum of supports that I've done. I worked at the other provider for about 8 years, almost 7, 8 years. I did a variety of, personal care needs. I was started as a direct support professional. So I started off as entry level worker. And a couple of years ago, I started looking around and I actually noticed Las Trampas doing things very differently. They actually built a brand new facility or a building here on their main campus. And they were actually paying just their DSP workers more, which was impressive. I reached out, just seeing what was going on, what was their secret sauce, and a conversation struck up, and here I am today.
What's a hobby?
Very famously anonymous. I actually do a lot of hiking and climbing. I'm part of a social media network or social group on Facebook called Bay Area Hikers. I lead a lot of hikes around the Bay Area. I'm very outdoorsy, go backpacking. I just climbed Mount Whitney with my daughter last year and my brother-in-law, and I have plans to go to Kilimanjaro this coming February and hike that. I would like to go to Mount Everest. I would like to go to base camp and take some pictures and say I'm at Everest Base Camp, but actually to take that much time off. And I would do work for a nonprofit. I don't have the money.
I would like to go to Kilimanjaro in Africa. That is on my bucket list of things that I want to do. I've done the Inca Trail. That was one of the best hikes that I've done in my life.
So I'm also a very avid baseball fan. I'm a big San Francisco Giants fan. I have my hobby. I collect Giants autographs, and I have over 700 different individual players who played in New York and San Francisco on a baseball at my home. My wife's very impressed with the collection, but it's a hobby. It's a hobby. And they're all personalized to me. But I mean, yes, I have Barry Bonds and Willie Mays, but I have very obscure players who maybe only played, maybe a season or two or a few games with the Giants. That's just another hobby.
All that 700 plus from the Giants over the decades?
Yes.
Wow. That's great. Well, so much for you being anonymous. Now that I'm going to put you on podcast, LinkedIn, and on YouTube, tell us more about what are the day programs and how are you working with the people?
The people who come to our program or any program, it's all about the person and their wants and needs and their hopes and dreams and what's important to the person, what's important for the person. We want to make sure that they have the choice of the classes that they want to be involved with, the people who they want to socialize with, and we support them to be as independent as possible in making those choices and independent as possible for their skills that they want to build. Because eventually one day we're not going to be here. So to leave a person with skills and abilities to be successful in their lives is one of our things. We also want to make sure that we support the people who come to our program and what's important to the person and what's important for the person. Important to the person is coming to the program, being social and, doing their projects or even going out into the community, which we do every single day. And what's important for the person, their health and safety too.
Sounds like it's all adults right now. I know you mentioned in history it was children.
Actually, 22 to 67 years old. Once a person usually gets into a day program, very rarely do they leave other than moving away or retiring. And day programs are in a high demand for anybody with the services that we provide. Besides being a social place for them to go, choosing the classes or activities that they want to do every day, it's also a respite for the families too, because a lot of our participants still do live at home with their families. And this is the break that they need also so they can do work and school in their own lives.
Forget how sometimes that's hard on having family members with disability or kids that can't go function on their own, but you still have to provide and do the things you need to do and socialize.
Exactly. It's much needed respite. And we can talk about later in funding. I mean, we do have a waiting list of over 50 some odd people to come into our program. We have a capacity for 120 people. We'll get into this later about staffing issues and whatnot. But even if I were to be totally filled here at the moment with the 120 people and staff, the dollars to donuts, I bet you I still have another list of at least 50 people waiting to come in.
Let's talk about that. Staffing challenges. I know that'll go into a budget, so we'll just hit them all, but staffing's been a big issue even in city government and other nonprofits throughout the whole East Bay area, where people have had trouble filling jobs or keeping them long term. And now that you can go to McDonald's and that job actually could pay better than healthcare workers in some ways. Talk a little bit about the challenges you have and the types of people you need for that kind of work.
It's always been a challenge. The profession that we're in, never been really recognized as a profession. It's always been, and the way the state has funded, now we don't set our own rates or pay what we can pay. The state sets our rates every year of how much we can pay and how much we budget out for it and our costs in general. We can't pay a competitive wage for somebody doing the same job. What we do with our personal intimate care, feeding, restrooming, G-tube feeding, the extra supports that we do are likened to almost a skilled nursing assistant. Skilled nursing assistants, on average are $25 up an hour. The low overhead and other financing that we have here at Las Trampas, the average wage is around $17, and that's statewide. Las Trampas is very fortunate the way we have worked our budgets and everything to pay just about $20 an hour, 20, 25, depending. The thing is that our wages go up very incremental. And we have to beg, borrow, and steal with the state government, advocate all the time, saying we need budget rate increases just to keep somewhat competitive. Along comes the fast food workers bill, which basically and instantaneously, April 1st, gave them $20 an hour. Well, for what we do here, $20 an hour is not a living wage for the care and support needs that our staff offer. The people who do stay in this profession for the long term, we do have some employees who've been here 22 plus years, but the majority of our employees stay no more than like 3 years on average. Sometimes less than that because it's more of a pass-through job. You can't make a real career or living out of this in the long run, except for some people who do succeed.
Because there's just little room to grow in terms of upward mobility, right?
Upward mobility, that's because of the wage stagnation that we have. That's the biggest thing. Right now, Las Trampas, like I mentioned, does pay a little bit more above what everybody else does, but still it's not enough to catch and retain the people to stay in this profession. We are working on ways to, attract new people. Maybe they do stay 2 or 3 years, and then they would eventually leave us to go on to something else. But that's more of a plan in the works for down the road so that we can sustain something. And plus, for the work that we do, to help somebody in the restroom takes a lot of integrity and dignity and respect for both parties to get in there, because I'm helping you when you're most vulnerable, which I still do to this day. Even as the director, I do from time to time do support people in the restroom.
I could appreciate the value and how just important that is for those workers. And right, it becomes to find the person for the same $20 an hour who could go work at a fast food joint now, or who can take somebody to the bathroom.
Exactly. Respect to everybody who works in the restaurant fast food industry. Got that. There was a survey done back in 2018, 2019, and there's another one going around now to identify who's in our workforce. The majority of people who are in our workforce are women, minorities, single parents. Almost everybody has a second job to make ends meet, and a good majority of them are on public assistance of some sort. The state, again, is asking us, all nonprofits who do this work, to deliver a high level of care, but not paying a decent living wage, or giving us incremental wage increases, but again, having to keep going back and beg for, please, can we have another increase?
Let's talk about this because it relates to the state budget and some policy things, and that's important to do on this podcast. And first, to clarify for everybody, I'm not anti the wage for the worker. What I'm trying at the restaurants and fast food joint, what I'm saying is, if your choice is to go work at a fast food joint for $20 an hour, part-time, that may be closer to your house, or help with a disabled person who needs help going to the bathroom and taking care of themselves, and the social takes a very warm heart and a lot of patience and everything. So I'm not knocking one type. I'm just comparing it to the same salary for two very different jobs. And we're going to use that now to talk about the budget and the pay and everything like that. Talk us through the history of the pay scale in this place.
The Lanterman Act that was passed back in 1970. Basically, that enshrined a person with a disability their right to state of California to services from the state, school, housing, etc., day programs. This is also the predecessor to the American Disabilities Act passed in 1990. The Lanterman Act also mandated, accessible housing, curb cuts, etc. Everybody had access. And it also gave a person with a disability rights the right to refuse, because before, a person with a disability you could do almost anything to them because they had a disability. Lobotomy, sterilization, forced medical treatments, etc. We went ahead and passed the Lanterman Act, which started to improve everything. We also had the state hospital system, which was basically institutions where anybody with a disability was just sent or dropped off. Finally, California came to the realization we could do things better and have people in the community. Regional centers were also created under the Lanterman Act. We have 21 individual regional centers through the state of California. So a person with disability can go there with a diagnosis and receive the state services that they are entitled to. The state would always set the rates, but they came to the realization that, we can do this a little less inexpensively by closing our state hospitals and putting more onto the nonprofits. And so from the state hospitals, you don't have to pay the overhead of state workers. We could do it for 2/3 of the price without, a union, without, all the medical benefits, even though we do offer medical benefits, but all the pensions and everything. The centers were set up into districts, catchment areas. We're in the Contra Costa County ones. That's Regional Center in the East Bay. Golden Gate is San Francisco, and they have Fairfield, Solano. There's different areas, and they call them catchment areas. And those are private nonprofits, just like we are a private nonprofit, funded by the state and federal government, mandated to have services for people with disabilities. We're governed by the Department of Developmental Services and California Department of State Licensing. So that's who kind of functions and who governs us for the most part.
We will add the 2 regional centers. Well, I'll put the whole link into the show notes, which again, for everybody who hasn't used show notes, you scroll down on your podcast app and you'll see them there. And it'll also be available via the blog. We've set up these centers. It's 100% state and federal funded. How do they determine the budget is it per person, per patient you're serving? Is it per staff? Do they put requirements on ratios for staff? How does it all work?
The state determines how many people we're going to we're serving throughout the state. Right now, we're about 460,000 people we serve through the state of California. I don't know the exact formula they use to designate per person, but from what I recall, they get about $34,000 a year per person. I think that's what it is currently, that a person can spend or use on a program, and other services too. If they want to support a living, they could receive that. Or if they want to support employment, they could also receive that. So ratio-wise, it depends on the program. Our program, we're a non-behavioral program. Our support staff is 1 staff to 3 participants, 1-to-3 ratio, or a 1-to-2 ratio, which is somebody who, for example, would need to use a wheelchair. So 1 staff could support a person who uses a wheelchair and a person who does not. Or if there's a 1-to-1 ratio, there's a little bit more. That's what we don't do. The cost does go up, and the state does make adjustments for it.
And is it the same price throughout the entire state? So there's no differences if you're in San Francisco and San Jose in terms of price versus Del Norte or Madera, where it's that $20 per worker goes a lot further and their rents are cheaper.
It's basically static across the whole board right there. Even if you're in Modesto compared to San Francisco, you're still getting the same rate. But the only trick is finding the providers in those more rural areas for services. It's harder to find, obviously more the population centers, Bay Area here. I mean, easier to find a service provider than somebody who's out in the Central Valley, even though they are out there.
One of the things we were talking about when we met, we were talking about that budget and the rate increase has been frozen for a long time. Is that correct?
So back in 2002, even before I started in this profession, they actually froze the rates in 2002. And then in 2009, there was actually the great 2008, 2009, the great budget recession. So they actually cut rate. Unfortunately, the DDS system, developmental disability system, has always been first on the chopping block. And we're usually the last to always get funded every single time. From 2009 to about 2018, the state, with a lot of advocacy, the Assembly and Senate said, hey, we need to do a rate study. And we were like, thank you. So the legislators came up, the rate study was done, and it was discovered, oh, you're underfunded by the tune of $1.8 billion. And we said, now you're hearing us. The legislators passed the laws and said, okay, rate increases that are going to be happening over the next few years since 2019, 20 incremental rate increases. And the end game was going to be 5, was going to be the last rate increase to make us whole. They did do little adjustments for cost of living because COVID hit and everything else. And so COVID has subsided, but we still advocated saying, hey, we still need these funds. And the legislators heard us again and actually accelerated our funding to make us whole by the end of this year of fiscal 2020, 2025. Back in January of this year, the government and legislative analyst office said, oh, we're going to be in a big budget shortfall. The governor in January proposed, hey, let's delay your increase in rates or fully funding you for just another year. Again, we are on the chopping block or the freeze block again because of the budget deficits and shortfalls that we're having right now. So we've been advocating since January, February with all of our local legislators, Senator Steve Glazier, Member Grayson, Bauer Cahan, who've always been very strong supporters and advocates for us, and reaching out to different assembly members with the advocates here from Las Trampas, Assembly Member Lee, who's on the budget subcommittee chairman in Fremont, advocating our point of like, this is a really bad idea because we would be short basically that $1 billion that we are looking for the system statewide. Not just us we're advocating for everybody in our community. Deny the governor's request for this budget rate delay. So last week, actually, we did have a glimmer of hope. The governor and the Senate pro tem came to an agreement that, this is a bad idea. Let's possibly not freeze our rates. So that was a glimmer of good hope for us. If we were to get our rates increases for this year to make us whole, that's only still a halfway point. We still don't have a cost of living adjustments going forward. We still don't have, rate increases that are scheduled to like, hey, every year we need to look, an increase in 3-5%, whatever is deemed necessary. So we're going to be having, even though we get to the goal line, we still have the goal line has been moved again. We need to go back and advocate again for continued rate increases.
Well, that's never an easy conversation or decision, I should say, for the governor and the legislature with battling priorities. Definitely a worthy cause, definitely needed, and probably keeps people up at night who are the caretakers. Just complicated in a budget shortfall year. I'm glad to see that you guys are advocating. Is there a statewide association?
There are numerous statewide associations. There's the East Bay Legislative Developmental Disabilities Coalition here in the Bay Area. There's ARCA. There's California State Disability. There's so many. There's quite a few, and they all do coalesce. There's a Lanchman Coalition that are all out there who are working for a common cause. They all do communicate with each other. And this year, our budget ask or our cause, instead of multiple ones, is really simple. Don't delay our funding. That is the drive home point to get us through and through. Because if we basically delay our funding another year, basically delays us, increasing any kind of wages for all our staff. It puts the these some odd people that I have on my waiting list, on a continued waiting list of like, sorry, I can't grow unless I have staff because it meets our ratios. It's a really simple ask this year that we're going after the state government for.
What message do you want to local elected official, local community members to understand about the work you're doing and how vital it is?
First off, it provides community for the people with a disability. We're out in the community every day. They have a place to go and purpose of what they want to do, And also, these people live in our community. The families live in our community. If our services were not here, the families now struggle to work and live in the communities that they call home. The people who receive our services want to be as independent as possible, and eventually will be living in the communities that they're currently in. Again, but now we're to a housing issue right there. Off the podcast.
That's a whole other podcast, actually.
Yes, being aware that all the providers do exist within communities is one other thing all our local elected officials should be aware of. We're pretty present here in Lafayette. We're well known because of, who we are, the very generous donors that we have here in Lafayette and La Miranda. They know the value of the services we provide for their family members, because we do have quite a few participants here at Las Trampas who we are the family because their family has passed away.
That's good background. And where can people learn more about Gibber in their community?
The best place to go would be the Regional Center of the East Bay, rceb.org, I think it is. Regional Center of the East Bay. You can find out who's in your area. And if you're not receiving services already, speaking of regional centers, that's another underfunded program. They are nonprofits funded by the state, mandated to give, people with a disability, the proper care and supports. They're just as understaffed as we are. Case manager with this delay again back in funding. Right now, case managers have a load of 100 plus people at times with them. And those are just the adult, not to manage the kids that are coming up through the system. Case managers, start out about $50,000 or $60,000 a year for what they do. They are, with this rate delay and freeze, hurts the system also. Case manager supervisors, they take on twice the load that a case manager does, because they're stressed just like we are. That's why we just don't need this delay in funding.
Thanks for joining me today, Jason Parks of Las Trampas, talking about serving our disability friends and community members throughout the East Bay. Thanks, Jason, for joining us.
Thank you, Jared. It was a pleasure.
Wait, don't leave yet. Hit subscribe. Make sure you get the weekly updates. We have a new episode every Wednesday for stuff happening in the East Bay. In the meantime, follow me on LinkedIn, Jared Asch, or check out our firm where we have a weekly newsletter and blog at Capstone Government Affairs on LinkedIn. Thanks for joining us today on the Capstone Conversation.